smoking is extremely detrimental to anyone's health, for your lung health, for your risk of having cancer, from your cardiovascular health, etc. And that is just unquestionable. It is very well established in the research, and whoever tries to argue with that is just someone that is trying to deny the obvious. When it comes to sperm health, there is no major difference. It causes a huge amount of increase in free radical damage. And that free radical damage has the capacity to arrive to the testicles or the testes where the sperm is created and cause lots of damage. And that damage causes fragmentation in the DNA.
Welcome back to the Holistic Health and Hormones podcast. I'm your host, Ellie Huang. Today, we're diving into a conversation that is long overdue in the fertility space. When couples are trying to conceive, the focus so often falls mostly entirely on the woman, her hormones, her cycle, and her body. But the truth is, fertility is a shared team effort. In today's episode, it is all about the male factor, how sperm health plays a critical role not only in fertilization, but in embryo quality, implantation, pregnancy outcomes, and even long-term health of future children. I'm joined by a natural health practitioner and naturopath, Raul, who is an expert in male fertility, and together we'll unpack what truly impacts sperm health, hormones, lifestyle due to stress, nutrition, environmental exposures, and the often overlooked emotional side of male fertility. So if you or your partner are on the conception journey naturally, preparing for IVF, or navigating unexplained infertility, this conversation is essential listening for you. So let's dive in. Welcome to the Holistic Health and Hormones podcast. I'm super excited to have Raul Pastrana with us today, who is a degree qualified naturopath and a recognized expert in fertility and reproductive health with a strong focus on male fertility. He is LGBTQIA plus friendly and passionate about breaking down complex health topics into practical insights for a broader audience. With expertise spanning male and female fertility, gut health, menopause, and weight management, Raul combines evidence-based nutrition, herbal medicine, and lifestyle strategies to help individuals and couples optimize their health and reproductive outcomes. He is particularly known for his deep understanding of lifestyles impacting on fertility, drawing on his experience as a personal trainer to help people integrate meaningful change into their daily life. He brings a fresh and engaging perspective to discussions on health, wellness, and fertility, making him sought after for podcasts like myself. Welcome, Raul. I'm excited to have you here.
I'm very excited to be here. Thank you for the invitation.
So tell me a little bit about your background. Like, how did you sort of end up as a naturopath in fertility? You know, you sort of were a personal trainer. How did you sort of get into the health and wellness journey?
I've always been into fitness. I've done exercise for a very long time. I've used to do swimming lessons and karate when I was a very young kid. Then I got into the gym. And when I arrived to Australia, I saw there was a very big fitness industry. So I decided to study personal training. I became a personal trainer, and then I knew that even though I was able to help my clients in the gym, there was a big area that I was not able to help them with. And that's why I decided to further my studies with naturopathy. And when I finished, I joined the mentorship program of Rhiannon Hardingham, who you obviously know. And that's how I got into fertility. And now I work with her in RH reproductive health.
Nice. Rhiannon's going to be on one of my future podcasts very soon. But yes, I love Rhiannon's work. So while male fertility, I mean, obviously as a personal trainer, you see that it's so interlinked, the male hormones with even like just how you perform in the gym and how your muscles are working with the deeper physiology of specifically men. It's very different from women, right?
Yeah, absolutely different. Like the way that we work, the way that our hormones work is completely different. Obviously, women have that menstrual regular cycle, while men actually hormones are a bit more simple. They're the same every day, or they should be the same every day.
You'd think, right? So in your experience, like we always forget about the male factor when it comes to fertility. And it's such a big topic in clients I see, and I'm sure in clients you see as well, that when couples struggle to conceive, so many times the doctors, the IVF specialist, their team of people really miss the entire male fertility is so often overlooked. So from your clinical experience, how significant really is a male factor in the fertility outcomes we're seeing in this day and age?
It's huge, and it's so unfair for those assigned female out there. This is why I wrote the book that we will speak about. The reason that gave me to write this book is because over the years of clinical experience seeing fertility cases and couples coming to see me, most of the times it was just them, the females, booking the appointment, coming with a long, extensive number of tests that they have done for their hormones, for the vaginal microbiome, for whatever they were testing. They already did a number of stim cycles to freeze their eggs. They were under lots of medical intervention, heavy medical intervention. And, I'm always happy to see any patients, but I ask, okay, this is great that you did all these investigations. Can I have a look at the sperm analysis of your partner? And in many cases, the answer could be, it hasn't been done. It has been done, but I don't have it, and the doctor told me that it was okay.
Fine.
And
Yeah,
then when
fine.
that was on the semen analysis result, it wasn't okay. It was far from okay. And they were told, let's go straight into IVF, and then IVF doesn't work, and then we wonder why. And then we get into this rabbit hole, and we are in a position where we are 18 months later, we are trying to treat something that should have been treated at the beginning, which is the male factor and the sperm health. And it is really unfair for females that they are carrying the burden of the fertility responsibility for so many months, sometimes years,
Yes.
before we identify that the problem in the first place is the sperm.
Yep. And that's what I've seen also. I mean, so many of them miss that. And we're going to talk about in the numbers later, but there is something, where we are seeing on paper, and a lot of GPs who are not trained think, oh, they look at it, oh, it's all within, the parameters. It's all fine. They've been trying for 18 months, longer, years. And then they go down the IVF path, and it becomes this vicious cycle, which we'll talk about, because there was not optimal sperm. It was very fine sperm, if we can even call it fine, right? But it wasn't optimal. So therefore, they're getting a lot of those sort of outcomes, which isn't great for the women, and a lot of the emotional, physical, sort of burden that comes with IVF. What are the most common misconceptions now? Let's talk about that you see around sperm health and fertility.
Well, I would say two. The biggest one is that there is nothing a male patient can do to improve their sperm health, right? It's like, oh, your sperm health is this. So based on that, let's just do IVF because we don't have other option. This is completely untrue. Like males, we are constantly creating sperm. It takes around 72 to 74 days for sperm to be completely created from the moment that the cycle starts until that sperm actually leaves the epididymis. And there is a lot of things that we can do in just 3 months to have a positive influence in that sperm quality. So the first result that you receive from a semen analysis is just your baseline, but you can improve a lot upon that. And what you need to do to improve depends on what's happening with your health. It might be that you need to take care of your sleep and focus more on that. It might be that you need to eat a little bit better and drink a bit less alcohol. It might be that you need to work on your stress levels. But there is definitely lots of room for improvement in most cases. The second thing that I think is a big misconception is the reference ranges, which I know that you want to talk about them. So let's just get on with it. Reference ranges are completely outdated. They were established more than a decade ago, and they don't represent optimal semen health. So we need to use a different reference range to understand whether or not the semen that the result of the semen that we have in front of us is actually optimal or not.
Let's talk about some of the reference ranges because, like I said, they're so outdated. I also want to chat about how we've seen that sperm health has declined 50% in 50 years. Like that is huge, right? I mean, obviously it's the lifestyle factors of what is happening today, but there have been massive declines from the men that we see today back to, 50, 60 years ago. It is crazy just how quickly. That's why IVF is such a big business right now, because I think the majority of the time, you're correct, a lot of the people who are having issues, they're going down to IVF, and a lot of the time it's the men. Women are a lot harder to test in terms of their quality, but for men, it's such an easy semen analysis, yet it's not being done properly. And if it has been done, the reference ranges are out and they're not understanding what optimal sperm parameters mean. So let's chat a quick about the numbers. So, I'd love you to sort of share, what is fine, which we see a lot. They're like, oh, the doctor said it's fine. I'm like, do you understand what fine means? Like, you're on the lowest of like the 5%, right? We want to be in the top 5% ideally, right? Not the bottom 5. So let's have a look at the parameters and what people should be aware of. And when they see semen analysis, they should be bringing it up with their doctors and understanding that, no, there needs to be work before we hopefully can conceive naturally and avoid IVF altogether.
Yeah, or doing IVF and have a much higher success rate because you were prepared for it, that you did the work that you need to do. So like you said, the World Health Organization established these reference ranges over a decade ago. And what they did, they analyzed the sperm of more than of thousands of men. And then of thousands of men that they were able to conceive naturally with their partner. And they established that the quality, the 5% of the lowest quality was enough to conceive, then that's good sperm. Or that's the reference range that we're going to use to understand whether sperm is good or needs to be improved. And when you're comparing yourself, you don't want to compare yourself with those that have the lowest quality and quantity of sperm. You should compare yourself with the middle, with the 50 percentile. And that's what I try to do with my patients. So for example, when we talk about a sperm concentration, the 50th percentile is only 15 million per milliliter, 1.5. While 50 percentile, 50 percentile is 73 million. So you can see the huge difference there. So if I see, for example, a male patient and the sperm concentration is somewhere in the middle, 50 million per milliliter, I say to this person, look, it is good. You're in your sperm, it has good quality, but we can still improve it. So just to give them an understanding, and I explain those reference ranges. Just to give you an example of another one, when we're talking about morphology, the reference range said that anything above 4% is considered healthy. When we know that the actual 50th percentile, the optimal reference range is above 15%. So that's just a couple of examples of what difference between average or minimal versus good quality sperm looks like.
And it's so hard because they're not understanding that. They think the reference ranges are fine. And even then, we're even seeing clients well below the WHO reference range. There are clients who are seeing, I'm sure yourself and a few I've seen, which are under 4% for morphology. Even progressive motility, how can they fall pregnant naturally if their count, their volume, progressive motility, morphology is well below the WHO reference ranges? So let's talk about, first of all, how does a client get into such poor sperm health? I mean, obviously it wasn't overnight, but was it something that you perhaps think that they did over the last 90 days, or is this long term? We're talking months, years, perhaps even decades of poor diet, lifestyle, health, sort of just health diagnosis over so many years.
Yeah, you said something before about this, that you mentioned how sperm health has been declining so fast, so quickly over the world, especially in developing countries like the one we live, Australia. And we need to ask ourselves, why is this happening? And it is not just one single event in most cases. It is the accumulation of how we're living our lives. We are, as a community, as a nation, we are more sedentary than ever before. We are sitting more than ever before. We're carrying more fat than ever before. And all these factors, we are more stressed than ever before. There is problems with insomnia, etc. All these factors are contributing to degrading or reducing the quality and the quantity that males are able to produce. Sometimes when you see a patient, and when I see a patient, I think it's important to take a good case history, right? Because if a semen analysis was performed 2 weeks later after the patient had, for example, an infection like COVID or influenza, then that's going to have a very negative effect in the sperm health. So that's something that I consider as well. Like, what was happening in the 90 days prior you did this test? Did you have any major stress episodes? Did you have any major infections and things like that? And I consider that, and I interpret the results based on that. Sometimes we need to repeat the test a few months later if that's the case. But if the test hasn't been performed, something that I talk about this in the book, is always wait at least a few weeks to a few months, if possible, if you have had a major infection, before you do the sperm analysis, in order to get a good baseline level.
Yeah. And also testing is really important. Let's just briefly touch on that, because a lot of them in Australia, they go to Medicare testing, and that is like GP, it's free. And a lot of those laboratories don't do what we call DNA fragmentation. So let's talk about DNA fragmentation. How important is that as one of the key markers to actually assess sperm health?
Yeah, well, for anyone listening, for any couples listening to this podcast and wanting to get their sperm maybe tested, what I will say is, like, the rebate of Medicare for a sperm analysis is just so low that it's not worth going to the doctor appointment, because you're going to end up paying more on the gap that the rebate that they're going to give you for the sperm analysis, right? So it's better just to find a lab that can do the tests, which there are many in Australia. Then the normal labs that we use for blood, they are not good for semen analysis. And that's because when you're doing a blood test, most of the work is done by a machine. When we are understanding, for example, what's the level of ferritin that we have in our blood, the test tube going to the lab, and most of the work is done by the computer. With the sperm, it's a bit different. We need someone under the microscope looking at the sperm, and that person needs to be highly trained in order to give us an accurate result. And the people working in our regular pathology, like Sonic, Melbourne Pathology, Douglas Handymore, they are very, very well trained for other pathology testing, but I find that sperm is not their forte, and it's better on a specialized andrology lab, which there are many in Australia. We have many here in Victoria. And I think you asked me something else.
Yeah. So what let's explain to the listeners, what if they've never had a DNA fragmentation test, what is it? What is the test for? And how are those results important for basically fertility and health outcomes for embryo quality?
This might have happened to anyone listening. It is that they have done a semen analysis, and they have checked sperm concentration, sperm motility, including progressive motility, and morphology, which are the most common parameters to test in a sperm analysis. But what they haven't tested for is for something called DNA fragmentation. And what DNA fragmentation tells us is what percentage of the DNA inside of the head of the sperm as an average is actually fragmented. So when we're talking about the future DNA of the baby, of the life that we're trying to create, we are trying to create a DNA with 46 chromosomes, 23 chromosomes coming from the mother, from the egg, and 23 chromosomes coming from the parent, from the sperm. And if inside of the head of the sperm, that DNA is fragmented, that can lead to an aneuploid embryo, an embryo that doesn't have 46 chromosomes. And usually that can lead to infertility, chemical pregnancy, or early miscarriage. And those are important factors to consider. So if DNA fragmentation is high, it's going to lead to an infertility or a miscarriage later on. And that's why it's good to keep it under 10%. I know that the reference range said under 15 is okay. I like my patients to be. That's what I see the higher success rate.
I have seen, and I'm sure you have too, that DNA fragmentation is extremely high, especially when you start asking diet and lifestyle factors of several miscarriages now for the woman, failed IVF outcomes, if they do test and it comes back, or if they haven't, to get them checked. I find a lot of that is coming from people with very poor diet and lifestyle, especially those who are smoking and vaping. Can we just touch on smoking and vaping real quick and how that is impacting sperm? Because there are so many men or couples who their partners are smoking, and they really shouldn't be. It is significantly impacting the sperm. However, they believe themselves that they've seen a friend or a family member, they're smoking and they have healthy children. So why should they stop smoking and vaping? Can we touch on how you believe smoking and vaping, that's just one aspect of, some poor diet and lifestyle choices that is significantly, especially DNA fragmentation and a lot of the other sort of sperm markers is severely impacted by, smoking at the moment?
We know now for a very long time from very big epidemiological studies how smoking is extremely detrimental to anyone's health, for your lung health, for your risk of having cancer, from your cardiovascular health, etc. And that is just unquestionable. It is very well established in the research, and whoever tries to argue with that is just someone that is trying to deny the obvious. When it comes to sperm health, there is no major difference. It causes a huge amount of increase in free radical damage. And that free radical damage has the capacity to arrive to the testicles or the testes where the sperm is created and cause lots of damage. And that damage causes fragmentation in the DNA. But it also causes damage with the motility and with the morphology. But you were talking about the DNA, and absolutely, it can bring the DNA fragmentation higher. And this is really unfair if you think about it, because for someone to behave like this, because if the female is going through a steam cycle, they are injecting with a number of drugs to over and stimulate the ovaries in order to produce a high number of eggs. That comes with lots of side effects. The female feel a little bit, their mood changes, they can have liquid retention, they can have a heavy bleeding episode, etc. There are lots of possible side effects that can occur. And they go through a lot from a financial but also emotional standpoint, the female. And then we obtain those eggs and we need to fertilize them with the sperm. For the male, obtaining that sperm is so easy. It's just so mechanical, right? It seems like a bit fair. And if we are using good eggs that we needed a lot of effort to collect those eggs. Very, very poor quality sperm from someone that was smoking, or for someone that was drinking lots of alcohol, or for someone that just didn't know it, but they actually needed more sleep, then that egg and sperm is going to lead to an embryo that is not going to be capable of producing a live birth. And that's really unfair for any female going through the steam cycle.
I've had a client, they've collected, the women's collected something like 13 to 15 eggs, right? High stem cycle. And then maybe if most of them will fertilize up until day 3. And then I've had clients I've heard from none fertilize at day 5. And it's just very upsetting because they've gone through a lot of that, right? And it has been, and if they do, they might get maybe 2 or 3, but they're not of great quality. And then obviously none of them implant. So how is that sperm health is not just about fertilization, but like you said, it's really the whole embryo quality because of the 46 chromosomes. It then has to implant and has to have this healthy live baby and contribute to the health of that child for practically the rest of its life.
Yeah, absolutely. We are seeing it how it's important not just for fertilization and for conception, but also for placentation, for during the pregnancy, like pregnancy outcomes like avoiding gestational diabetes, preventing any complication during the pregnancy can be prevented with good quality sperm. Not always, and there are other factors that the female is involved, obviously, but I think males, we need to give the best chance possible.
Just the fertilization of, obviously when it comes to the long-term implantation, embryo quality, and the long-term, child health, it is so important that it is really they are doing their bit, but they are also contributing to the outcome of basically how the IVF success is going to be due to the quality of the sperm.
Yes, and you mentioned before, and this is what I was going to touch on, that you had a patient recently that had 15 eggs on a cycle, and that can seem like a very positive outcome, but then we need to understand that egg quality is also very important, and then we need to question whether or not those 15 eggs had actually good quality. So sometimes more is not better when it comes to egg collection. Sometimes 8 or 9 is better than 15, but it really depends on the patient. So while we are talking about male factor, I think it's important that it's completely shared. Like the male and the female need to be involved. Yeah.
So then after that, when we looked at it, she hadn't actually done a sperm analysis, or they did, but it wasn't actually, it was just brushed over. When I asked them, what was the sperm health like? She showed me, and it was actually 1% morphology. That's why they had the 15 eggs, none of them fertilized by day 5. She'd actually gone overseas all the way to Cyprus to do this, because they wanted to do gender selection, and they ended up with 0 embryos to even implant, which is terrible for a lot of these women who are having similar results through IVF. Can we talk about ICSI? And then one of the things that I think a lot of the specialists, fertility specialists, will be like, if the sperm health is poor, instead of IVF, let's go to ICSI. Let's talk about how ICSI works. And also, is that even the next best option if sperm health is actually still quite poor?
Yeah. So you said before that the morphology of the patient that we're using as an example was 1%. And what I have to say is that usually with IVF or with ICSI, the morphology and the motility to a certain level can be bypassed. And that's because the person looking under the microscope can see the sperm and can select the one that is moving the best and the one that looks the best, the one that has the best morphology. So therefore, you can bypass the problem of morphology with science and choosing the one that looks the best. But there is something that it cannot be seen under the microscope, and that's the DNA inside of the head of the sperm that you're choosing. So regardless of how good the microscope it is, if your DNA fragmentation is high and you're choosing the sperm, you might be choosing one that has a very high DNA fragmentation, and therefore is not going to lead to blastocyst, or if it leads to a blastocyst, is then going to lead to early miscarriage. So this is very, very important to understand. We cannot bypass DNA fragmentation. If it's poor, it's going to affect the embryo quality and the pregnancy outcomes. And then you mentioned what is the difference between IVF and ICSI. In IVF, the technology is just you leave the egg and you leave some sperm that you have selected, and you allow for the sperm to naturally fertilize the egg. In ICSI, you actually inject the sperm inside of the egg. That's the difference between the technology. And what I see with my patient is that when they're doing a stem cycle and they collect, let's say, 6, 7, or 8 eggs, in many cases, and this is something that has changed recently, fertility doctors are using 50% of the eggs for ICSI and 50% of the eggs for IVF. And that's just the way that the trend is going at the moment.
Yeah. So no, it's such a good point that a lot of the time, if they haven't done that important DNA fragmentation, which is generally through a private andrology lab, they're not knowing their numbers. It is significantly impacting, perhaps if they're having multiple failed cycles, something to look at for sure. Let's talk about testosterone. How does testosterone truly relate to, I guess, male factor fertility, and why does the normal lab ranges can still mean suboptimal fertility for some of these men?
Yeah, okay. So testosterone, when we talk about the spermatogenesis or the sperm synthesis, it all started in the testes with a stimulation from FSH, which is a hormone that is called follicle stimulating hormone, and it comes from the brain. It arrives to the testes and stimulates specific cells in the testes to start producing sperm. Up to that point, the sperm production wasn't dependent on testosterone. But in later stages of sperm maturation, FSH is not responsible anymore, and it's all about testosterone. So what happens when any male has poor testosterone levels is that it can lead to immature sperm. So the person might still be producing sperm, but they are immature. And that's because the process of maturation is completely testosterone dependent. Testosterone obviously is the male sex hormone and is responsible for many things in our body, like muscle synthesis, brain cognition, bone maintenance of bone growth, but is also responsible for sperm maturation. And this is why when a male has poor testosterone levels, it can lead to immature sperm. And what you were mentioning about the reference ranges, it happens the same a little bit with sperm. In these cases, they are very broad. So in most cases, the number given at the right-hand side of the result is something like 250 to 900 or 300 to 700. And we're talking about free testosterone here. And as you can see, that range is just so broad, right?
Mm.
And what we need to understand is in context with the person. So if we see a 25-year-old, a 30-year-old with a free testosterone at the bottom end of the reference range, we know that that's not okay. Young males should be creating and should be having more testosterone. Well, if we see like a 50 or a 60-year-old with their testosterone level at 300 or 400, that might be perfectly right. So it's all about giving a bit of context to our patient results, that it's what we're good for.
What about age? We just touched on age. You said when you're measuring sort of 21-year-olds to like 50-year-olds, is there an age where male fertility noticeably declines? Like, in females, you always hear, oh, after 30 and then after 40, your egg quality definitely declines. Is there that same thing that you've seen for male fertility, and what risks, increases as the man gets older?
It works a little bit different than for females. So for females, the egg quality starts declining a bit earlier than for males. We see a decline from anywhere between 25 to 30 years for egg quality, and a bigger decline happening after 35 years of age. And that's why a lot of women are choosing to freeze their eggs earlier in life. Men can do the same. They can freeze their sperm if they want to, but sperm health in males tends not to decline until at least 35. Some males can even maintain sperm quality and quantity very optimal up to 4 years of age. And then there is obviously there is a decline from 40 to 45, and that decline is it's higher after the years of 45 years of age. So yeah, I would say after 40 is when the sperm starts declining in quantity and quality.
Then we know it all has to do with lifestyle factors. So let's dive into that, because it doesn't matter what age. Like, you can see people with very poor sperm health, in their 20s, and you can see men with great optimal sperm health in their 50s. So, let's talk about how obviously diet, lifestyle, which you love to touch on, is truly impacting the outcome of male fertility.
Yes. So, and I talk a lot about this in the book, and I call it the 4 pillars of health. So you have nutrition, exercise, stress management or stress, and sleep. And if you have those 4 pillars covered and well managed, higher chances that your sperm is gonna be in good shape.
Yeah.
But if any of those pillars is not work on, if it's there is something going on with that, your sperm health is gonna be negatively reflected. So when we're talking about nutrition, it's really individualized, but we live in a very obesogenic society that promotes eating lots of crappy food. So I always go through what is happening with their lifestyle and try to address one thing at a time as I go through the consultation. But I find that when it comes to the pillars of health, I need to give a very personal treatment to my patients, because everyone is different.
Yes.
If we talk about one of them, like for example, stress management.
Yeah.
I see how high levels of cortisol can definitely have a very negative influence in sperm health. From a physiological perspective, what's happened when there is chronically elevated levels of cortisol is that leads to a reduction in other hormones, like for example, testosterone. And that, like we explained before, has a repercussion in sperm health. And stress in itself is not bad. Like, if we, for example, go to the gym and have a workout, that is a stress that we're applying to our body. If that stress is not too much and it's within measure, and then we give our body enough time to recover with good diet, good sleep, good nutrition, then our body has the capacity to adapt to that stress, and we become stronger, faster, we have more endurance. But if we are exposed to chronic levels of stress, whether that comes from emotional stress, environmental stressors, or overtraining that also happens, then we are negatively influencing our sperm health due to cortisol factors.
And there's a lot of people who aren't managing their stress well, and it affects the females just as much, right? So long-term stress it's going going to impact so much inflammation, gut health, and, a whole range of things. Because you talked about how to individualize male fertility support rather than using a one size fits all, which is generally what they tend to do with IVF doctors. When you see conventional medicine, it's
Mhm.
like, oh, you've got infertility, here you go, IVF. And they haven't addressed any of the underlying health parameters, which we need to look at the whole person, because the long-term health outcomes of these men and their hormones is going to impact their long-term health. We want to make sure that their hormones are regulated, same like women, right? Because we want to make sure we are healthy individuals and we're going to be around for, for the baby that we're going to have and be in the best health possible, which is why infertility, I think if they haven't looked at the root cause, the semen parameters are one thing, but then really going down and saying what is actually causing that, which is where, the beautiful work that yourself does is really individualized, and a lot of people aren't getting that individual support.
Absolutely. I think we live in a medical model,
Yeah.
unfortunately, that is one size fits all, like you said. It's a protocol. Your sperm is not ideal. Let's do IVF. You have too much cholesterol. Here is cholesterol medication.
Yeah.
Have high blood pressure. This is a high blood pressure, which is basically one problem, one pill. Um,
Mm.
Instead of saying, okay, you have high cholesterol. Why do you have high cholesterol? How is that affecting other systems in your body, like your cardiovascular system, but also your reproductive system and your sperm health? So really getting to the root of the problem. So that's what I think naturopaths we do beautifully well. We also have a bit more time with our patients. Like most GPs are just trying to do the best they can with the tools that they're given. And fortunately for our patients, we have a bit more time with them, and we can really dive them into their case, and we can do a bit more testing to understand, okay, let's see what is affecting your health and your circumstances. It's something that I'm seeing very rapid. Lots of high insulin for my patients. So I'm really focusing a lot on blood glucose control. I'm testing fasting insulin and fasting glucose to all my patients to see the results, because I know that it has a huge effect on the sperm health. And then the treatment that I give them, again, it depends on their lifestyle, on their routine, and what it is that they're doing and they're not doing. Are they doing exercise? They are not. And it depends. But then I have my go-tos when it comes to blood glucose and high insulin.
Can we talk about some of the go-tos? I mean, obviously it's very individualized, but what are some of your favorites, or most men really should be on, especially if they're trying to improve a lot of the sperm parameters, be it one, or it will help with the majority of the sperm parameters, especially if they're all fairly low? What are some nutrients or supplements that are most evidently backed for improving general sperm parameters? We'll list off a couple of your favorites, and then obviously it's an individualized process. But yeah, I mean, what are some of the favorites that men should be taking anyway?
Yeah. Well, the first one is actually not a supplement. The first one I would say, if you only have $60 a month to spend on something that is going to have a huge impact, go to the gym or do some sort of
Well,
exercise. Maybe join like a Pilates class or a
mm,
yoga class, or go for a run or join the gym. I think the easiest for many males or for many patients is just join a gym. And
yeah,
that's because from a blood glucose perspective, and insulin resistance is the thing that has more effect. And the good thing about exercise is that it doesn't only have an effect on blood glucose. It also has an
mental,
effect
emotional.
on walls, improves the sleep, mental health. So I always encourage my patients to do some form of exercise. And for some of them, what I tell them, if you're not doing absolutely anything, let's start walking. And then we can talk in a month. But that would be the number one. And then when it comes to supplements, like you asked me, my two go-tos will be definitely inositol and lipoic acid. There is actually a little bit of evidence of inositol. We use a lot of inositol in our female patients for
Yes.
gestational diabetes,
Yeah.
which is extremely backed up by science. And now we have new evidence coming in the last few years showing how the same supplements, lipoic acid and inositol, they also have a lot of power to help improve sperm quality, especially morphology.
Amazing. Okay, so we just mentioned on the sort of mental and emotional health, but a lot of the male infertility if they are getting the test back, I mean, it's kind of like a sort of smack in the gut for a lot of them. And they feel like, oh, there's something wrong. And, there's that sort of shame and it's all my fault. How is that important to making sure that they are on this sort of partner journey? Male fertility can be a silent shame for many men. How do you find that is important for the men to emotionally go through this process and support that mental health, especially in that couple? This communication is one part, but how do you sort of see that as being contributing to that long-term, communication and outcome?
A huge part. There is lots of shame, lots of like, I am not enough because my sperm is not enough. I see a lot in clinic. Obviously, I'm not a psychologist, but I try to support my patients the best I can. And I think any practitioner, any medical professional, the best way that we can do that is come from a non-judgmental point of view, trying to take care of our patients the best we can and understanding that they're doing the best they can. Sorry. So I always explain to them, and I already tell them when I give them the slip for the referral, this is just for us to know. We are not looking for anything wrong. We're just looking for information so that we can improve upon that. And if we get a result that is not great, that's completely fine because this is completely reversible. So doing the work will get much better position. And I think knowing that if the result is not what they hope for, they have power and control over their future. That gives the person and the patient that you have in front of you a lot of room to say, okay, I have control over my future.
And it also removes the label of unexplained. I mean, I'm sure you've seen in clinic, as have I, that when they come in, they've been labeled as unexplained. As soon as we get that sperm test, it wasn't unexplained all along. It was actually, perhaps the hidden cause of what has been holding them back for conceiving and having that healthy baby.
I would like to change unexplained for underdiagnosed.
That's right. There's no such thing as unexplained. When you dig a lot deeper, there's a myriad of tests that we can look at. There's always something which we can do to find the root cause and then improve upon that. Because if you don't know, you're not going to know what to improve and what to change.
Correct. Exactly.
And so look, just I guess touching on IVF and some of the outcomes, what should couples really be doing what should they be doing differently, right? If they are going to look at conceiving or looking at doing an IVF cycle in the next sort of 3 to 6 months. Obviously, we would love for them not to go down the IVF cycle if it is a male-factored fertility. Like you said, 72 to 75 days is not a long time to perhaps, even 3 to 6 months to significantly improve those numbers. And should they, be able to fall pregnant naturally, a lot of the time they can without needing to go down IVF. But if they are, or couples that are needing to go down IVF, what can they do to really optimize, that sort of time frame and give themselves the best success possible?
Yeah. So the first step is if the couple has never tried to conceive, my advice will be start behaving 3 months prior starting trying as if you were already pregnant, both members of the relationship. So no alcohol or minimal alcohol. Make sure that there is no late nights. So you are prioritizing your downtime and your recovery. You are exercising, but not over exercising or under exercising either. Just something that feels right for your body. That you're prioritizing organic food versus non-organic, especially just to name a couple, like berries. It's very important.
Antioxidants.
Organic berries, because berries comes with lots of pesticides. But in general, like for those 3 months prior conception, prioritizing and getting the food from good markets and organic where possible. So that will be my advice for any couple who is just in the first step, I'm just going to start trying. If after a number of months, 6, 12 months, whatever you think that is, whatever the couple thinks that is appropriate, they consider it's taking too long and I feel that there is something that is not right, I need to get tested. That I need to get tested needs to come from both sides of the relationship, from the female and from the male. It is unfair that the female goes to the doctor and get tested and the male doesn't. And it happens all the time. So we need to change the paradigm. We need to change the conversation. If the female is going to the appointment, either you make a different appointment or you go with her and you get tested at the same time.
Mm.
Why? Because if you get tested at the same time, chances are that you are going to find where the problem is.
Yes.
Maybe there is something that you both need to work on. Maybe it's the female factor, maybe it's the male factor, but you will find it at the beginning. If you don't do it this way, what it can happen is that only the female gets tested, start treatment, and then we found out that actually the biggest chunk of the problem was on the sperm. So let's be fair and responsible on getting tested at the beginning. That's what I would. And then try to, like you said before, don't agree or don't. If you go to a specialist or to any health practitioner and they give you the diagnosis of unexplained infertility, keep looking, find another health professional that is willing to keep searching for that factor that is affecting your fertility, because there is something going on there. And unexplained infertility is like telling you, I don't know. I don't know what's happening, and that's why I give you this diagnosis. So find someone that is willing to do a bit more investigations with you.
That's such a great tip. And really, I guess, as a closing message, because we could talk so much on this topic, we could be here all day, that just as a closing message for those couples who are listening today to truly understand about male fertility, what is that one message that you want them to sort of take away from what we've spoken about today? I mean, there are so many.
The one thing that your sperm can improve, and the reason that I'm repeating this is because if the male understands that, much more chances this person will get tested, much more chances this person will change something in their life if the result is not what they hope for, because they know that they have control, that they know that sperm health, quality, quantity, DNA fragmentation, motility, everything can be improved with the right changes, with changes in nutrition, changes in exercise, changes in stress levels, reducing alcohol, etc. You have control over your future. That's what I will say anyone listening and taking home this message.
Thank you so much, Raul. You shared so many beautiful nuggets with everyone. Please tell us about your new book and how people can get a copy if they want. So what's your new book about and where can we get a copy?
So the book is called The Male Factor. The subtitle, Fertility is a Shared Responsibility. And I think for anyone listening to this podcast, they will understand already what is it about. It is a manual. It's a guide that I think couples and especially males need to read in order to understand why sperm health is important, how do they need to get tested, what they need to compare the reference ranges to. All the information is there. And what are the things that they are negatively affecting their sperm health and they need to fix. And what other things like supplements, nutrition, and tips for lifestyle they can start implementing to positively influence that sperm health. So all that is like a manual for any male or any couples that they want to maximize their fertility outcomes. At the moment, it's just an ebook. I will think about printing in the coming months. That is, the ebook is coming out next month. We already have the pre-sale for purchase with a 30% off for anyone that is interested in our website in rhreproductivehealth.com. You just go to bookstore and you will see that the pre-sale is already on. So encourage
we'll drop the link. Yeah, we'll drop the link in the chat and people can, grab a copy. I'm sure it'll be very enlightening for all you couples out there. But thank you so much, Raul. It was so fun chatting about the male health. I think it's much needed for so many people who are lost and trying to figure out, what has been going on. It could be the missing link. So good luck to all of those on the conception journey. I think, stay healthy, really implement some of these changes and reach out if you need any help on your journey. Thank you so much, Raul, and I hope to have you on again. And there's so much more we can chat about. There is a lot about male health that I think is definitely missed in a lot of the mainstream medicine. So thanks again.
Thank you, Ellie. It's been a pleasure.
All right. Thank you. Thank you so much for tuning in to today's episode of the Holistic Health and Hormones podcast. If there's one thing I hope you take away from this conversation, it's that fertility is not just a women's issue. It's a shared journey. And when we support sperm health, we strengthen conception outcomes, pregnancy health, and the foundations for the next generation. So if this episode resonated with you, I encourage you to take a moment to reflect on how both partners are being supported physically, emotionally, and hormonally in your fertility journey. And if you're feeling unsure about where to start or you'd like some personal guidance for you or your partner, please reach out. You'll find the booking link in the show notes. And if you found today's conversation valuable, please share it with someone who needs to hear it. And don't forget to follow or subscribe so you never miss an episode. Thank you again for being here, and I'll see you in the next episode.